fascinating presentations this morning and also yesterday. I think it makes it easier for me because the things I'm going to cover today have been touched upon already, and it just validates actually some of the global trends that we've been seeing at Qlik. For those of you who don't know Qlik is a global organization. We operate in the visual analytics space. We're probably most commonly known as disrupting the business intelligence and the analytics world about 10 years ago, where we took analytics and BI and we gave it to business users to be able to self-serve and answer their own business questions without having to rely on IT. And that's really where Qlik really accelerated. Qlik has around about 40,000 customers around the world. We operate in over 100 countries around the world. And what I want to do today is take you through some of the trends that we are seeing in the healthcare industry globally. I've got a few slides that I want to share with you in terms of what are the common challenges that healthcare organizations have when you are deploying analytics within your organizations. I've got a short case study, and I want to show you some really cool looking apps. So I know I've got a very short amount of time, a lot to cover. So let's go through it. So in terms of trends, I think a lot of these have been mentioned already by a lot of the presenters today and also yesterday. So when we look at the global health environment, we've seen that there's a huge focus on improving efficiency and reducing costs within health systems. There is a shift of payments to be more sort of outcome-based and activity-based. We're seeing attention more on quality measurements. We heard from Dr. Poe earlier this morning around the quality measures and patient outcomes. There's an increased focus on population health, again something which was mentioned today as well. There is also greater focus on transparency in health systems, and I don't think South Africa is any different. The thing that really pulls all these trends together is the number of data systems that we have now. That we've had more we don't have more data systems than we do have today. It's not uncommon to have sort of 20, 30 or 40 different data systems within a hospital, and to try and get some insights into that is a real challenge for organizations. And so we've got a quote here from E. Wilson, which says that we're drowning in information while we're starving for wisdom. And I think I'll probably extend that quote and say, well, actually, we're drowning in data, but we're starving for information. So in terms of some of the issues and challenges that we see healthcare organizations face when they want to deploy analytics and business intelligence in their organization, the first one we've mentioned already is these multiple different data sources that spread across operational, financial, and clinical systems. How do you bring those data systems together to really make sense and to give clinicians and hospital managers, administration staff, the holistic view that they need to really understand what is going on within their hospitals? They have no real insights into the current operations or conditions that are going on because of the data landscape that exists. Governance we touched upon earlier during the panel discussion, but governance is very, very important. The integrity of that data is very important. We're not just talking about governance in terms of securing that data, we're talking about governance around standardizing how we're going to use that data, standardizing the measures and the KPIs that we're going to be using to report on our business. And how do you make sure that we don't have multiple versions of the truth in the organization? Organizations, the decision makers in organizations, they need this data to make data-driven decisions. We've all heard of the term of becoming more of a data-driven organization. Use this asset that we've got to become more data-driven. But if the people who need to make the decisions don't have that data, don't have that analytics point of decision, what they tend to rely on is their gut feeling and their gut decision. So this aspiration of becoming a data-driven organization becomes a challenge. What we've seen in the past is that, especially with sort of more traditional BI tools, is that because is a low user adoption. The primary reason for that is because the intuitiveness of those systems to be able to use them, the flexibility, the ability to move around the data, have the freedom to ask and answer questions, streams of questions. And quite often, it takes a long time for these systems to be implemented. There were some surveys done by IDC where the average implementation for a traditional BI tool was 12 to 18 months. And that's even before any business user gets their hands on that data. And so quite often, once the implementation is done and they've got new requirements, it takes weeks and weeks for new reports to be generated. And quite often then the business has moved on, the requirements of that report are no longer relevant, the data is there. So these are some of the challenges that we've seen organizations that we've worked with come across. Now, quite often, and this has been spoken about the last 2 days as well, this is the kind of utopia. This is the vision where all our different data systems comes together and we stage it and store it into a big data platform, into data lakes and a centralized data warehouse. And this data warehouse contains all our transformed and clean data, and we can report off it, visualize it, create dashboards, and it's all trusted. The reality, however, is very, very different. This is the reality that we often find in hospital organizations. Yes, you do have a data warehouse, but actually not all your data sits in that data warehouse. Maybe you'll have, very good, 60, 70, 80% of your data in that data warehouse, but there is always data that sits on the outskirts of that data warehouse. So it might be medical records, it might be HR information, it might be workforce sort of information or finance information, survey data, data that's on-premise, data that's off-premise. So how do you bring all that data together? How do you combine the data that's in your data warehouse with data that's not in your data warehouse, which is essential? What we've seen over the last couple of years especially is this sprouting of lots of different standalone visualization tools. But in our view, visualization is not the answer. Visualization on its own is not the answer. We had a discussion in the panel around what can visualization do. Visualization is very, very important, but it's only about a small piece of the puzzle. If you look at data, you need to get that data, you need to connect to that data, you need to pull that data through, you need to enrich the data, you need to model that data, you need to apply governance and security over that data, and then you can start to visualize it and start to use it, and that's when people start to trust that data. Quite often in organizations what we see is that people need to procure lots of different tools to go on this journey, a separate tool to connect to the data, a separate tool to transform the data, a separate tool to stage the data, and then finally a different tool to be able to visualize the data. At Qlik, what we've tried to do is create a platform that caters for all of this journey, from going from data, raw data to dashboard, or from raw data to reports, and to be able to allow business users to uniquely drill into that data, ask streams of business questions without having to rely on IT, to be able to drag and drop and self-serve and create my own visualizations, personalize the analytics in a user-friendly way that I can consume the information on any device, any platform. And we've done this for lots of different healthcare organizations. Globally, we have around about 1,500 healthcare organizations using Qlik, and many within South Africa here as well. Just very quickly, what I want to take you through is a quick case study. This is for the New South Wales health system in Australia, where they took an approach of implementing analytics, not on a hospital level, but a complete health system level. Within the New South Wales health system, had around about 110,000 employees. And what they were really looking to do was to improve patient outcomes. And they took a four-phased approach to that. Firstly, they looked at their data, the accuracy of that particular data. They reviewed the data. They wanted to understand the cost and the clinical variations. They made some changes in the processes. They then measured the outcome of that to see whether it was having a change and impact on patient outcomes. This is a portal that they developed using Qlik. It's called the ABN portal, so the activity-based portal. What they looked at in this particular example, this is on hip replacements, and I'm going to try and use a pointer. I'm colourblind myself, so I won't be able to see the red dot, but this is based on hip replacements, and the chart on the right, what it shows is variation in terms of the length of stay. So we can see, for example, we've got some doctors or some patients staying in the hospital for around about 5 days, but on the other side we've got some patients staying in for 16 days. Similarly, on the left-hand side, what the chart is showing is the average cost for the particular procedures. And so there was a huge variation. They were able to use this dashboard to really drill into the data and understand why this variation was occurring. This is the process that they went through. They actually analysed over 500 million records of data. They took data from multiple different data sources. They applied case mix, which was around sort of applying weighting and different criteria to the various different complexities of the cases. And they produced this portal which gave them lots of different KPIs around that particular data. I think with this was another one which is around risk stratification. So understanding what are the risks. With this particular portal, what they discovered was that 0.3% of their patients equated to 13% of their overall costs. And they want to understand that particular variation, where the potential risks was. The Qlik chart at the bottom left that you can see there that highlighted the various different procedures that were carried out over the different months, and the size of the bubble indicated the variation of those procedures. So again, they could drill into those and really understand what was going on. So just to summarise on this particular case here, what we've got is, I think New South Wales is the only health system in the world that has actually given money back to the states. Through this process, they're able to save over $500 million of reducing waste and variation within the organisation. 2 minutes?
Thank you very, very much. It was most interesting. So the deployment of this, I mean, it's amazing. It's just, it looks so easy. And that's exactly what you guys are trying to do.
That's what we focused on. For us, it's about making it intuitive, because as we spoke about in the panelists, if it's difficult to use, you're going to get a very low user adoption. And a low user adoption equals a very high total cost of ownership, and also a very low return on investment.
Well, Sunil, thank you so much. It was absolutely fascinating. Thank you very much. And Qlik, you guys have got a stand here.
We have just number 22. So if you want to have a look at some of the applications, we've got that particular application on display there. We can take you through it, and we can show you some more insights of some of the capabilities that we've got within Qlik.
Great stuff. Thank you very much. Sunil, a round of applause, ladies and gentlemen.